So we're going to talk about progressive pathologic myopia in neuro-op. Obviously, this is a refractive thing and a retinal thing as well, but sometimes it ends up in neuro-op. Some people refer to this as malignant myopia, but really it's progressive pathologic myopia. Normally it has to be a high myope, so it's going to be greater than -6 or higher, 7, 8, sometimes double-digit myopias. And the reason it comes to us is they are going to have decreased vision. The most common things that cause the vision loss in progressive pathologic myopia is thinning of the retina, so they can get retinal tears and a retinal detachment, so you have to warn them about trauma and wear safety glasses. But sometimes the thinning itself just causes slow reduction in vision from loss of retinal function because the eye is getting bigger, axial myopia, but the retina is not replicating. So you have the same amount of retina covering a lot more real estate. So you have 10 gallons of paint, but you have to paint 20 gallons of house. And if you have 10 gallons of paint painting 20 gallons of house, some of the paint is going to be thin. And if it's super thin, it'll detach or get a hole in it, or retinal detachment. But if it's thin, it also won't work as well as it normally does. The other thing that it comes to us as is nyctanopia, which is night blindness, and not-opia C, nix night. And so myopes often get night myopia. Their myopia is worse at night. And that's because your pupil is dilating at night. And so if you're a myope, the light is hitting the edge of the lens. And so that makes the refractive error more noticeable at night. So people who have big myopia don't see as well as night. And they might have to have night glasses that are stronger myopic refractive error and spectacle correction. And we can see esotropia or small angle hypertropias. That is the myopic esotropia. The myopic esotropia is also a mechanical thing from the axial myopia. Even though it's called heavy eye, the eye is actually going up superior temporally in between the superior rectus, lateral rectus band, producing the esotropia of myopia. That's sometimes called the heavy eye syndrome. So the esotropia of high myopia is heavy eye. So progressive pathologic myopia is bad myopia, it's progressive and it's pathologic and can cause decreased acuity on the afferent side, either in the day, the night, or both. And it causes an esotropia on the efferent side, a heavy eye syndrome.